A key part of the spirit of Sherman is our gifted clinicians, our doctors, our nurses, our professionals. And I'm so delighted to introduce the president of the Sherman medical staff to share her thoughts with you. Please welcome Dr. Dory Poulos.
Hello. I'm honored to be chosen to say a few words on this occasion. I have bittersweet feelings at this time, as Mr. Jekyll spoke of, and I think that many of us share. I've spent 25 years of my life as a family physician on the east side of Elgin, and Sherman has been here for over 100 years. Times have changed. The current hospital is old, and parts of it are a bit shabby. As we know, the old Sherman is landlocked and cannot grow in this location, and all of the growth in our community is to the west. So it has made perfect sense to have built our new home on Randall Road. We've all been there, and we know how magnificent it is, and I know that it will serve us and our patients well for many decades. But even though here at the old Sherman, the rooms are small and awkward, and the ER is cramped, and the floors on labor and delivery slope so that the instrument tray rolls away from me at inopportune moments, and even though the roof leaks sometimes, I love this place, and I will miss working here. As is the case for many of you, I am not only a caregiver here, I've also been a patient. My 2 children were born here, and Sherman Hospital saved my life more than 15 years ago. Thank goodness that all the people are moving to the west side, or I would really be desolate. I'm also very happy and relieved that we are leaving substantial services behind on what will now be called the Center Street campus. The east side community will still have the convenience of laboratory and x-ray, several doctors' offices including our practice, and last but not least, a 24/7 urgent care. Sherman Hospital will still be here, just in a different capacity. Nonetheless, it is very fitting that we say farewell at this time to the old acute care hospital that has been here for over a century and has been part of the joy and suffering of our community for so long. Thank you for joining us today for this farewell.
I think it is fair to say that this day would not have occurred were it not for the vision and the drive and the dedication of our next speaker. Ladies and gentlemen, please help me welcome the CEO and President of Sherman Health System, gentleman with a very special heart and a special spirit, Rick Floyd.
Thank you so much for that, and also for being here today on this chilly day. We wanted to bear witness to over a century of high-quality, compassionate care at this place. The people of Sherman have been caring for this community in this place for that period of time. And however excited we are about the future, we wanted to make sure we took a moment to remember and to reflect on the life that has happened here, sometimes the deaths that have happened here. It's been a proud tradition of excellence, and as has been shared already, for many people, it's been the place they spent the most time across many, many years. It's a place we love. It's a place that will always be in our hearts and minds. We wanted to take a moment as well to do a couple of symbolic things. And the first thing I'd like to ask us to do, some of you have shared memories which you have written and are now in this box, and that will come with us to our new home at Randall Road. And it will be available there still if someone didn't get around to sharing their memory, either in writing here or on film with Tris, so that if you have something you want to include in this, and to make sure that gets carried forward, that thread of continuity gets carried forward, you'll have that opportunity. But today, at this time, I'd like to ask our longest-serving board member, Rick Jekyll, one of our very long-serving employees, Linda Leitner, and the president of our medical staff, Dr. Poulos, to symbolically close this memory chest as we move the hospital and our emergency department to the other side of town. Thank you for that. And as I said, those memories will come with us. They are part of us forever. And we want to honor those with a special place. And the last I heard, they're going to be in our meditation room. So I hope that's exactly where they will be. I also wanted just another symbolic act we can all share in, to ask you, some of you have bells. Anybody have a bell out there? And our chair of our hospital board, Terry Dunning, has a big one. But I'd like to ask each of you to ring out the old and ring in the new. Join me. God bless Sherman Hospital. I guess the last thing before I turn it back to Rick, I think we're going to have a walk around the campus once again just to say goodbye to this place. And I think you all know, especially for those of you without an overcoat, we're going to be gathering in Assembly Hall for a celebration in a few minutes. But I hope that we'll take this time to honor the traditions, the spirit, as Rick said, of Sherman Health that has been such a part of this community for over a century. So thank you for sharing in this moment of remembrance and this moment of celebration. Thank you.
Now, ladies and gentlemen, may we have one final rousing round of applause for this wonderful building, Mother King. Let the remembrance walk begin.